Good afternoon, everyone. I'm Jennifer Salerno from Possibilities for Change. Welcome to our webinar, Addressing Social Determinants of Health Using Motivational Interviewing Strategies. Before we get started, Ufoma from the School-Based Health Alliance would like to provide some information.
The School-Based Health Alliance is the national school-based healthcare advocacy, technical assistance, and training organization based in Washington, D.C. The School-Based Health Alliance works to improve the health of children and youth by advancing and advocating for school-based healthcare. As youth-friendly and accessible settings, school-based health centers are uniquely positioned to deliver high-quality, confidential services that equip children and adolescents with the information, tools, and support they need to be healthy and safe where they are when they need it in school. We believe that children and adolescents deserve to thrive. When health and education come together, great things happen. Please join us and become a member. Our members extend and support our work. Trainings like this webinar would not be possible without the support of our members. In addition, our members receive exclusive access to valuable program tools, timely publications, and networking opportunities. Please take a moment after this presentation to visit www.sbh4all.membership for more information and to join. The 2020 National School-Based Healthcare Convention will be held June 23rd through the 25th at the Sheraton Denver downtown in Denver, Colorado. Join the School-Based Health Alliance, the Colorado Association for School-Based Healthcare, and your peers from around the nation for 3 days of engaging workshops, networking, and fun. The theme for the meeting is School-Based Healthcare, Elevating a School Climate of Health and Safety. As a premier national gathering for our field, the convention is a fantastic opportunity to connect with hundreds of fellow school-based healthcare professionals and advocates from across the nation. Registration is now open, and we hope to see you all there.
Right, thank you so much for that information. Before I begin, I have a few housekeeping items. Please view the presentation in full screen mode. Some fonts or images might appear small, and full screen mode allows you to see everything that we're sharing during the webinar. Participate in activities. We're hoping this is going to be kind of a back and forth versus you just listening to a webinar. Ask questions throughout by using the questions chat box. You can see that in your panel. We've included some handouts for your review after the webinar. We'll also provide the PowerPoint slides. So if you would like to have access to the handouts and the slides, make sure you download them from the handouts section before you leave the webinar. So lastly, at the end of the webinar, you'll have a chance to ask more questions, and that's when we will answer them. So as we're going through different pieces, if you have questions, feel free to type them in. Also, at the end, we will be providing a link in the chat box that you can use for an evaluation. So at this time, we're going to start the webinar. Thank you for your patience from the very beginning. I apologize for some of those little technology snafus that we were having. But I'm excited to work with you today. I'm using motivational interviewing strategies to support your efforts with youth focused on social determinants of health. So that's a little bit different than what you may have done with motivational interviewing in the past. Our objectives for the time we have today, you can see them on the slide, to identify motivational interviewing strategies to promote positive change and describe the use of motivational interviewing strategies in brief interventions for social determinants of health risk factors. We'll be using a variety of the GoToWebinar features, including those polls, chat, and a video. So at this time, we'll not be using webcams going forward so that you're able to see everything and interact without difficulty. All right. So we've all felt a little overwhelmed when we're thinking about social determinants of health in our youth patients and with our families, especially with all of the other work that we need to get accomplished. And in some of our sites, we have very limited staffing models. So thinking about bringing in something new always causes a little bit of anxiety. And then figuring out how we're going to, once we identify those social determinants, how we're going to help our youth and families. So how can we both effectively and efficiently address social determinants of health? And I'm hoping this webinar will help you feel more equipped to do that. Just a quick overview so that we're all on the same page related to social determinants of health. We know that health behaviors are increasingly recognized as multidimensional, not just the symptoms, the diseases, and those outcomes, but embedded in the environment and lifestyles. So it's really that interrelationship among those factors that determine individual and population health. And we know working in school-based health centers and FQHCs and other practices, those factors really impact the health of our youth and their families. So because of this, interventions that target multiple determinants of health are most likely to be effective. So you may see them categorized as they are here. So those social factors like their environment, the home, school, community, particularly those tangible needs that they may have for food, housing, running water, electricity, and experiences. So they may have feelings of being treated differently or discrimination, and all of those social factors will impact health, along with health services. So what do they have access to? What has their experiences been? Those individual risk behaviors, factors, and experiences that we're used to identifying. And then that biology piece, those health risks that might be inherited or are genetic. So throughout the webinar, I'm going to share a little bit about a social determinants of health project that's happening in Michigan right now with 52 school-based health centers that are using a risk screening tool called Rapt Public Health. The Rapt PH was developed in partnership with the American Public Health Association, their Center for School Health and Education. And really the Rapt Public Health builds on the core risk behaviors and factors that you probably are typically screening, and captures the prevalence of those social and environmental conditions that also threaten youth health and progression towards graduation. So the SCOH content within the public health questions are those content that you see at the bottom of the screen here. So miss school due to maybe providing care, working, or because of transportation, some academic success and reading questions, question about asthma and symptoms, respiratory symptoms that may be impacting school, those basic needs like food, water, electricity, being homeless, being in a coercive relationship, or pregnancy, and having experienced discrimination. You can see here what some of the greatest needs that have been identified are. Those top 5 include academic-related risks, those not succeeding in school, missing school, having some difficulty reading, experiencing partner violence, and then those respiratory symptoms of asthma. And out of the tangible needs, food has come up as the most needed. So we're going to do a quick poll before we get started into more of the specifics of social determinants of health. So I want to know how many of you are already screening for social determinants of health risks, and how are you doing that? So you'll see on your screen the poll, and what you want to do is choose A, we don't screen currently if that's where you're at. B, we ask questions verbally, so there might be some questions you ask. And then C, we use a standardized tool. I'm going to give you a few minutes. It looks like almost half of us have voted so far. So if you haven't, take this opportunity. All right. It looks like about 3/4 of us have indicated, and about half, I'll share those, about half don't screen currently, and then about 1/3 ask questions verbally, and another third use a standardized tool. So this will be great to kind of talk through what some of those questions are and how we can implement that. So as part of the Social Determinants of Health project, we also asked providers and staff in those school-based health centers, what do you need in order to feel more equipped to identify and address those social determinants of health in your setting? And you can see here probably some of the same things that you're thinking about: additional training on social determinants of health and having that experience addressing it, training on communicating with youth once you identify those risks. And that's really what we're focusing on in our webinar today. Resources in the school-based health center, having those reference guides or information that can be provided to youth and families, and then those referral sources and community school partnerships to support youth and families. So I'm sure those are all the things that you're thinking about as you're considering how you're identifying social determinants of health risk, and then what do you do with that afterwards. So one more poll before we jump in. I want to get an idea of your experience with motivational interviewing. So did you come today thinking, I've kind of heard the buzzword MI and want to know what people are talking about? Or have you attended a training or two, or do you use it routinely? And you should be able to see that poll now. And it looks like people have figured out how to vote and use the poll. So I'll give you another couple seconds. We have almost 3/4 of everyone having kind of submitted a response. I'm going to share the results, and it looks like we're pretty split. So about 37% don't have a whole lot of experience. So this will be a great kind of first taste into what's included in motivational interviewing strategies. About the same amount have attended a training or two. So this will kind of build on that. And if you use it routinely, I'm hoping the examples with social determinants of health will really just kind of help you think through how you may use it in different ways. Great. So MI, or motivational interviewing, has really been studied extensively and shows a lot of promise as an effective intervention with adolescents in a variety of settings and with a variety of risk behaviors, including some of those social determinants of health risks. So we know what's really great about motivational interviewing is that we're kind of moving away from telling teens what to do, because we know as soon as we do that, we will end up with some resistance from teens, and we want to kind of guide them towards change or towards seeking assistance versus telling them how to do it. So it's really kind of a dance. We know information alone is not enough to change behaviors. If it was, that would make our jobs so much easier. but it's not quite that easy. And the MI process really allows the team to drive kind of the discussion. So you don't have to feel like you need to have all the answers. You're really posing questions and using some of the other strategies to help teams think through how they may choose to do something differently or make decisions around receiving services. So once you identify risk factors, being effective in using motivational interviewing has a lot to do with our verbal and our nonverbal language. So how we look, how we're managing our emotions is really critical. If we've had a super busy day, if we have our arms crossed, how comfortable we are in the topics that we're talking with youth and families about can all affect how much they share with us, how honest they are with us. Also, how we phrase questions. Do we put teens on the defensive by asking why questions or questions that prompt for the answer that we want to hear, like you can see here? You want to graduate, right? And then how we provide that discussion or that risk coaching once we identify a risk that we want to talk about is also really important. So we want to try to avoid lecturing and advising. That's difficult because of the positions that we have, and we have a lot of information that we know will help teens in making decisions, and we can provide that. We just want to do it in a different way so that it doesn't feel to them like we're lecturing or advising them. We want to elicit from them what their motivations are and what their needs are. So we don't want to talk with them initially and say, you know, the first step would be to make sure you're getting to school every day. We want to guide the conversation so that they provide that option or that step, and or we have an opportunity to share that after they've kind of talked through what they think they can do. And I'll provide some examples of everything that I'm kind of sharing right now. So motivational interviewing is based on building relationships and using specific strategies to elicit information from teens and then guide them towards making safer decisions or following through with resources. So we're going to talk through the spirit today and some of the basic motivational interviewing strategies in the short time that we have. So part of the spirit is really empathizing, and empathizing doesn't necessarily mean that you agree with what the teen is doing or that you're saying it's okay. You're really coming alongside them and showing them that you understand. So to show empathy, you may say something like what you see here as an example. You're working really hard to keep things together at home and at school. Using a statement like that before jumping into solving a problem can really help build the relationship quickly, where you don't have to spend a lot of time, and the youth then feels like you are listening and understand where they're coming from before we try to start problem solving. Another example would be in starting a discussion maybe about food insecurity with an empathetic statement like, it's difficult to concentrate when you haven't eaten breakfast. When you use statements like this, leave a few seconds of silence to allow youth to respond to that empathetic statement, because it may catch them off guard. They're used to kind of adults doing most of the talking, not necessarily trying to understand where they're coming from. So give them a few seconds of silence, and once they respond, you may follow up with some of those questions that lead towards that solution. So maybe a question like, what are some of the ways you've gotten food in the morning or before school? What are some of the things that you know you could do? Another component of spirit is asking permission. So when you have a two-way discussion with a youth and not all one way where we're kind of pushing information only to them, we're building a relationship where they feel valued and respected. So if you start by asking permission, especially if the teen hasn't asked us to provide the information to them, we know we have information that we want to share, and asking permission helps them be more open to hearing it and participating in the discussion. So you may start with some statements like, I'd like to talk with you about, and then you could plug in whatever it is that has been identified, maybe on a risk screening tool, or that you want to continue talking about with that youth, or might be an issue. So it might be, I would like to talk with you about getting to school, or about your asthma symptoms, or even I'd like to talk to you about the survey you just completed, so that they know you're kind of bringing it up. And you might say, is that okay, afterwards. You can also use a question starter like, can I share some other ideas for? So if you're talking through a situation and you want to brainstorm, ask them, what do you think you can do? And then before you share ideas, can I share some other ideas for getting more food, for managing your asthma, for getting help with reading, whatever it is that you're talking about. And most teens will respond positively. Asking permission can sometimes make you feel a little bit anxious or afraid that they might say no. It doesn't happen very often, but if it does, just have something in mind that you're going to follow up with. So maybe if they said no to, can I share some other ideas? Ask, well, what ideas do you have? Or they don't really want to talk about whatever the risk is that you plug into that statement. You might ask them, well, what's on your mind today? So that they have a chance to say what they're feeling, and then you can probably come back to it later in the discussion, or maybe the next time you see them, depending on how important it is that you talk about it that day. So now we're going to touch on the foundational strategies of open-ended questions, affirmations, and reflections using some of the social determinants of health content areas. So the O is for open-ended questions, and the key to using them as part of motivational interviewing is that you're deliberate and directive in how you ask a question that really leads teens towards talking about a risk, and ultimately you're trying to get from teens or hear from them kind of that change talk or talking about plans or what they'll do next around improving their situation. So it's very deliberate and directive. We all know kind of that who, what, when, where, how as open-ended question starters. We just have to be careful with the why, but we want to ask them in a way that will help them start thinking through their situation a little more deeply. And that all has to do with brain development as well. So depending on the age of the youth, you may use different types of questions, because different ways of asking questions will elicit different responses. You might use some of the fully open question starters, like, what do you think about? You might say, what do you think about becoming a parent? If you're talking about pregnancy, or maybe a partner that wants the youth you're talking with to become pregnant, tell me about getting to school. If you want to know what some of the challenges are, if that's one of the areas that have been identified. How do you decide when a relationship isn't healthy? When you're talking about coercion, or help me understand is great to put in front of why questions, because it takes the why off the first word, and that automatically takes off some of the judgment of it. So help me understand why your asthma has been acting up this month. So those are all really great fully open questions. And remember, once you ask a question like this, let there be a little bit of silence so that the youth can respond to that. And if they don't give a response right away, you can say, well, take a second. I'm really interested in what you think about this, or how you decide, whichever question starter you're using. So you can give them verbally that minute or two, let them know that you're going to wait. And then key questions are really important in moving to the next level or planning on what you're going to do. So you might say something like, given everything that we talked about, what do you think you'll do next? maybe when you're wrapping up a visit or even in the middle of a discussion, when you want to kind of get them to start thinking about moving to the next stage or step. Where do you want to go from here? What if you tried, and then you might add in some ideas? What if you tried talking to the school counselor? What would it take for you to feel more confident in reading? I really like the what would it take questions because it gets teens to think, what would they need? It really helps you understand what the steps might be. That would be the first things that they would be thinking about. The how, if at all, is really great when youth are not quite sure if they want to take any next steps. So you might say, how, if at all, do you see yourself getting to school every day? And then the last one, what do you see as your options? Those are all really good ways to ask deliberate and directive questions. So now we're going to practice moving a closed-ended question to an open-ended, because if you start kind of paying attention to the way that you're asking questions, you'll probably notice that you use a lot of closed-ended questions just automatically. So the first step is kind of being aware, and then the next would be practicing how you could change questions. So if you use the question box in your panel, type in your response and then click send. How would you change this to take it from a why to an open-ended question that would not start with why? Because why is one of the words that does have some negative kind of feelings sometimes when you're asked why. So how might you reword this question so that it's still an open-ended question, not closed with a yes or no response, but doesn't start with why? So I'll give you a few seconds to type some things in, and then I'll share some of those. Okay, so some of the responses. What are things you can do so you don't miss as much school? So that's great, open-ended. Tell me about, so you're using some of the fully open questions. Tell me about the things that are keeping you from getting to school. Help me understand what's keeping you from school. These are all really great open-ended questions that don't start with why. And the help me understand is great if you wanted to keep the why in there. And what I found when really learning about motivational interviewing and using strategies in different ways is when you have a why question, or maybe you ask why often, the easiest thing to do is turn that into a what. So that's one of the examples that I just shared with you. What's keeping you from getting to school would be a way to do that. So keep that in mind as you're working on deliberate, open-ended questions. So the next part of motivational interviewing is affirmations, or the A, and it's really a focus on keeping a positive view of teens and sharing the strengths that you see in them. It really empowers teens when they hear some of the strengths that they have, because that's not really what the focus is for teens. They're always thinking about like what they look like on social media and how they're not doing things right, and their grades and friends and what people think. So we want teens, we want to empower them to take care of and value themselves. And part of that is through affirmations or identifying strengths. They're not I statements, they're you statements. And that can feel weird because we were taught to use kind of I before we make a statement, and you statements can be very powerful instead of using I and starting with you. So if you and I were talking about your work and I said to you, I think you're great at your job, or I said, you are great at your job, how does that feel different? Think about that for a second. How does that feel different if I said, I think you're great at your job, or you are great at your job? It's much more powerful to take the I piece off, and then it doesn't rely on me. So if I see that in you and I say, I think, then anytime the youth would be around me, they would feel like that, but they may not incorporate it as something that's with them all the time. And it's not bad if you say, I think this, but it's more powerful if you take that piece off and you say it with you statements. So in motivational interviewing, there's some affirmation starters like you have, you are, you feel, and you believe that you can put strengths to. So some examples might be, you've worked hard to improve your grades. You're managing your asthma on your own. You feel comfortable enough to ask for help. You believe it's important to take care of your body. All of those are examples of strengths that you're putting into this you have, you are, you feel, you believe statement. So let's practice this. Just one statement that you might hear from a teen that's just really frustrated, and I've tried getting help to pay bills, it just never works out. You're trying to help them kind of figure out how to manage either they're living on their own or maybe with their families to meet those tangible needs. So how would you, instead of starting out with the problem solving and ideas for change, how would you affirm what they're saying here first? Use the question chat box and type in some like you have, you are, you feel, you believe statements that would be around strengths, that we're really trying to boost their self-esteem. Great, so we have some coming in. You are managing your money on your own. That's very powerful. You're making a real effort to solve these problems. That sounds difficult, so adding the empathy in there. You're being very creative to make this work. So I'm very excited. You're adding empathy into some of your responses and then providing that affirmation. So those are really great examples. And there's lots of other great examples as well. We just don't have time to go through all of them right at the moment. So reflecting is the R of the OAR, and one of the primary skills used in motivational interviewing. It's also one of the most difficult to master. It's how we would express kind of that we're actively listening, that it might be an empathetic statement that we reflect, that we really understand what our youth are saying to us. Teens often perceive themselves as not being listened to, so reflections can be very, very powerful in kind of keeping them sharing with us, honest about what they're sharing, and open to kind of that problem solving piece. If you have a risk that can be solved, not everything has a solution. Reflecting involves stating back to the teen kind of what you heard. So not in a question form, but a statement, and then possibly adding either an emphasis, an additional meaning, or a continuation of their thought. So it's not just stating back exactly what you heard from them. And then tone of voice is really critical. So if you have an inflection at the end, it makes a reflection statement sound like a question. So let me give you a few examples of that. So if we look at the discrimination question in the Rapt public health, we ask teens if they feel stressed because of being treated differently by people in their lives. And some of the social determinants of health risks are not necessarily issues that we can resolve at that visit. And that can feel frustrating because we want to help youth and we want them to be successful and be happy and be healthy. And we don't always have the ability to kind of solve the problem. It's not as easy as writing a prescription for an illness. But what we do know is that when we allow youth to disclose risks and we provide that safe place for them to talk through, it can really help reduce their risk, reduce their feelings of stress and potentially, feeling sad about that. Just giving that opportunity for them to say it out loud is a great first step. So if we have a youth that's stressed by people that are treating her differently, you might just repeat that. You're stressed by people treating you differently. And if you notice, I just said it as a statement. If I put an inflection at the end, it would turn it into a question. If I said, you're stressed by people treating you differently, then it sounds like a question. So that's where the tone of voice comes in reflections. So that would be a simple repeat. And you might be thinking like, why would I just repeat what I just heard them say? Maybe that's going to sound like, okay, what are they going to say next? But what it does is kind of builds that relationship and lets them know that you heard what they had to say and were understanding what they had to say. So then they usually will continue talking about that risk or that situation. You might rephrase, so you might stay close to what they said with a little bit of rephrasing, like you would like to be treated fairly by others. So it keeps along the same line, but you're moving the conversation a little bit. So maybe now they would be focused on talking about, what does that mean to be treated more fairly? What would that look like? Paraphrasing is another reflection that you're kind of guessing at the meaning of what that youth might be saying and then reflecting that back. Oh, I don't know why that didn't come up. Sorry about that. You're stressed and you want to find a way to deal with it. That might be kind of moving them to the next point. You're feeling stressed, and then what are some ideas they might have in dealing with it? But I didn't ask the question. I made it a statement or a reflection, and they will continue the conversation. So we don't always have to ask a question in order to kind of keep a discussion going. And then reflecting feeling is really emphasizing that emotional dimension. It gets frustrating when you feel like someone's judging you. So as you can see with the different ways that I shared in reflecting, that the next part of the conversation from the youth might be different depending on how I chose to reflect. So same as using open-ended questions, when you're reflecting, you're really guiding that conversation in the direction that you're hoping that teen will continue the discussion. So I have two polls related to reflections. They're a little bit more difficult. So what we have here is a teen statement on the left and then possible responses on the right. Obviously, there's many more that you could respond using reflections. So if the teen stated to you, seriously, I don't want to be interrogated about my home life. What are some ways that you could respond that are reflections that would be deliberate in helping them move forward in the discussion, in maybe being able to receive some referrals or resources? A is, this is too important not to talk about. B, I'm trying to get you what you need. C, what does your family need? And D, I care about you and want to share resources that could help. So remember, we're looking for reflections. So I'm going to launch the poll now. So you see the team statement, and then you want to make a reflection that can help them think more about the situation and potentially continue to move to change. And that change might be to receive a resource, or it might be in something that they could change about themselves if it's more of a risk behavior that they're choosing. So I'll give you just a few more seconds. I'm going to close and then share the poll. And what you can see, the first A, this is too important not to talk about. That is definitely a fact, in that if something's going on at home, depending on what that is, it is very important, but you probably don't want to start out with that. You're trying to, they're a little bit defensive and maybe resistant. So you may end up saying something like that, but probably not the first thing that you would say. B, I'm trying to get you what you need. So yes, you want to share that you're here to help. C, what does your family need? That is a great open-ended question. We're looking for reflections here first, and then you may get to that point. So D would help lead that team to lower their resistance and also to understand that you're trying to help them. So I care about you and want to share resources that could help. That reflection would help them understand your motivation. You're not trying to interrogate them, and what you want to do. So D would be the most ideal, but none of them would be wrong answers. And then the next statement, I talked to the school nurse about my asthma, but I don't always have an inhaler to use. So A, managing your asthma is frustrating. B, I have some ideas that might help you. C, you want to manage your asthma and need to get an inhaler. D, it's great you're talking to the school nurse. So again, none of these are incorrect. What we're looking for is the reflection that would help lead them to telling you what their next steps might be, or some more information around what's going on with them. And here's the poll. I'll give you just a few more seconds, because reflections do take some thought. Okay. So the first one, managing your asthma is frustrating. That's definitely a reflection and kind of coming alongside. You're empathizing with that person. B, I have some ideas that might help you. You definitely want to get to that point. You don't want to start by sharing your ideas first. C, you want to manage your asthma and need to get an inhaler. That's really about what you believe would be the next steps for them. So you want to manage your asthma and need to get an inhaler. You're hoping then that they talk about what they'll need or how they can get their inhaler. But you're affirming that they want to manage their asthma. And D is great, you're talking to the school nurse. That is an affirmation as well, that you found a resource person and that person is able to help you through some of the management. So none of them are incorrect. C would be the most correct in getting them to kind of think about, and the next thing they would talk about is what they would need in order to get their inhaler without having to ask the question. So reflections are really a dance, and there's lots of different reflections you can make when you are responding to something that a youth has said that can help direct the conversation in different ways. So these were examples of that. So I'm going to show a quick video related to identifying some tangible needs and an example of using some of the motivational interviewing strategies.
So, how about stress? During the past month, how much stress would you say you experienced? A lot of stress, moderate amount of stress, relatively little stress, or almost no stress at all?
Well, now that you've got me reflecting on it all, it's been pretty stressful.
Mm-hmm.
Yeah, quite a lot this month with the delivery of a newborn and added expenses, car breaking down, work hours not being stable. Life is stressful.
Yeah, sounds like a lot of different things going on at once.
Tell me about it.
Well, it must take a lot of strength from you to keep powering through all that.
I do what I do, or what I can do.
Yeah.
Yeah.
Well, it sounds like your family is really important to you and you want to do everything you can for them.
Yeah, that's my job.
Yeah. Well, of the things we've talked about today, it sounds like there's some things that you feel like are pretty solid, like your housing situation, baby's able to stay with grandma, those feel good for you. And then there's some things that are a little bit more of a strain. There's the groceries piece and transportation, phone bill, some financial stressors. And it sounds like you also just are kind of feeling a little worn down by the stress of it all.
That's true.
I'm wondering of those things whether there's anything that stands out to you as a priority. Like if you were going to focus on one thing to try to improve your health, your well-being, how things are going in your life, what do you think it would be?
We're really happy when we have the nice food on the table and mom's eating well. I'm able to help cook it, and it'd be really good to have more money to buy some of the foods we prefer or are starting to like. That would help a lot. I notice everyone's happier all around that way. And maybe cut down on that beautiful greasy slice of pizza.
Yeah. Okay, so being sure you're able to get healthy food sounds like your number one.
Yeah.
Well, that's definitely something that we can partner with you here at the clinic. Is that something you'd like to work with us on?
Great.
Okay, so let's find a time to see what we can do.
Yeah.
Okay.
Loving it.
Thanks for your time today, Charles.
Yeah, thank you, Ariel.
Great. So hopefully that helped kind of bring some of those strategies into a client visit so you can kind of see how she was using that to elicit more information from him and provide some feedback of a conversation that they had earlier. So it was kind of more towards the end of that. And I'm happy to share additional videos. You can also look on YouTube and search motivational interviewing. You just have to be careful because a lot of the videos are not great examples of motivational interviewing, even though it says that they are. So a few of the social determinants of health project results that we've seen from the school-based health centers, kind of those stories from the field, in bringing in identifying those social determinants of health risks. Some of the stories, it's really pushed me to assertively assess resources for our students by developing relationships in the community, that there was a student who was missing school because they couldn't pay for their asthma medication, so they were able to figure that piece out and get donations from a local church. It was found out that a student didn't have running water, so they were able to arrange for her to take showers at the school. So that's really thinking kind of about all the resources when you wouldn't necessarily be able to impact that tangible need in the household immediately. How can we work together to kind of get youth what they need? And then the last one, students were reporting that they were not eating breakfast and that they didn't always have food at home on the assessment. So they reached out to a local church and food pantry, and now they drop off breakfast snacks that are put in the school-based health center lobby for students, and then backpacks for them to take home on the weekend. So those are really nice stories. As you know, it's great to be able to say not just what the need is, but also how you've helped to address that need. And that's the most challenging piece. So adolescent-focused motivational interviewing training, we have facilitated a training over the last 5 or 6 years, specifically focused on adolescents and their risks, equipping professionals to use MI strategies. And we kind of briefly went through some today. I know if you don't have a lot of experience with motivational interviewing or just a little, it may have just given you an idea of what MI is, but really taking a training and immersing yourself in that information can help you feel more confident and understand it a little bit better and how you could use it in practice, what feels comfortable to you. The training that we have partnered with the School-Based Health Alliance on includes an online interactive component of learning modules. So you complete those prior to coming to the in-person workshop, and then an on-site workshop to translate that knowledge into effective practice with adolescents and with their families. And what we're going to be doing is offering a pre-conference adolescent-focused motivational interviewing, but specifically for social determinants of health. So during that pre-conference session, we'll go through all of the same motivational interviewing strategies and really dive into what we shared or what I shared in the webinar just briefly today to have discussion, help you understand how to use the strategies, what it looks like when you're deliberate, when you're asking questions, how to do that, and using reflections and affirmations, and really getting into the details more. So please, if you're considering that, if you're interested, it's going to be solely focused again on those social determinants of health topics, which can feel challenging because we don't always have some solutions to those. Sometimes it's more about identifying, letting youth kind of share their experiences and being that safe place to then kind of figure out what they would need next. So it includes that online learning module. There's going to be a little bit of peer-to-peer discussion using Basecamp, and then that on-site workshop on Tuesday the 23rd. So you can register today going to the School-Based Health Alliance website and registering for the conference and the pre-conference session. So we'll send some information after this to provide link to you to register if you're interested, or at least take a look at the information that's on the website. Also, there's a link in the chat to complete the evaluation. If you don't see that link, you should see it in the chat. we will be sending it out by email after this webinar as well. So you don't have to worry about clicking on that now. Participating in the webinar, hopefully it didn't feel overwhelming or like too much information. It was really meant to give you an idea of motivational interviewing and a little bit of a taste. Hope that you can take away a few of the strategies that can enhance the work that you're doing with youth and their families. At this time, make sure to download the handout if you want to do that or take a look at it. We'll be following up with a recording of the webinar that the School-Based Health Alliance will post. You'll also be getting a follow-up email that'll include the evaluation link if you're not able to click that or have time to do that right at the moment out of the chat. And just remember, you don't have to have all the answers. So you're practicing kind of using these strategies to learn more from youth, elicit from them what they think they need, and then to offer some additional suggestions and resources and referrals when you have those. So practice some strategies, get comfortable, and then add on some new ones. Attend the pre-conference workshop, and or there may be other motivational interviewing workshops in your area. So if you have any additional questions, please post them in the question box, and I will read through those really quickly. And if I don't get to your question, then I'll definitely reach out afterwards individually if it kind of got mixed in with some of the activities we were doing. Sometimes that helps. So there's a question about how do you register for that in-person class, and we will send out some links. So you would go to the School-Based Health Alliance, their website, and the annual conference that's in Denver this year, and register for the pre-conference session from there. And it looks like there's not too many other questions. The reflections activity definitely had multiple answers that were appropriate reflections. So there isn't necessarily a correct answer except for the answers of the reflections that were leading you to kind of those next steps, or for that teen to share more about that situation. That's what you're looking for there. Okay, great. Well, I appreciate everyone's time, and I hope to be seeing you at the School-Based Health Alliance conference in June, and that everyone stays safe and healthy. Thank you so much.